Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist, and I'm here to talk to you on behalf of the Lennox-Gastaut Foundation about a medicine called Sympazan oral film, which is also a form of clobazam with a new delivery mechanism. Next slide, please. Sometimes patients need an alternative formulation to take their medication. Sometimes patients like a liquid because they can't swallow a tablet. Sometimes the patient's on so many tablets a day that it's very difficult for family to keep crushing up and giving more tablets, either due to taste or just the number of tablets per day. Patients can be resistant to that, sometimes spitting out some of the taste that the medicine that tastes bad, or perhaps the number of medicines can make them gag and spit some out. And obviously people with Lennox-Gastaut syndrome or other developmental epileptic encephalopathies and even refractive epilepsy in general will certainly be on more than 1 to 3 medicines a day, and typically more than that when they think about other medicines that may be there for behavior or other medical issues they may have. So this was developed as another way to give medication. It comes as a gel that you can put onto your tongue, and it dissolves and gets absorbed through your stomach. It does not get absorbed through your tongue or your cheeks. It still gets absorbed through your stomach, but it once it's on your tongue, it sticks and you can't spit it out. And it's one less thing to crush up or give. And it's a nice alternative for some patients. Sometimes also, if a patient can't take a pill, but they also don't want a liquid, this is an alternative that works very well as an alternative. Next slide. So it's an oral film that you can see the small dose is very tiny, and then proportionately a double that size is a 10 milligram dose versus a 5 milligram dose, and then there's a 20 milligram dose. And all of these have an even distribution, and this oral film just gets put on the tongue, and then it gets dissolved very quickly. You don't need to give it with water or liquids. And so you can give it to someone who has trouble with drooling, or someone who has trouble with their secretions, because it'll stick to their tongue and dissolve and go down, reaching a maximum concentration fairly quickly, similar to taking it might even be a little faster than taking a tablet. Once it's on their tongue, it's hard to spit out. So if you have someone who spits their medicine out, it can be useful that way as well. And you can see it comes in these pre-wrapped foil packs, which you then open up, and then you have the little square that you see in that person's thumb and forefinger in the middle, and then you can just put it in the mouth as shown, and it gets absorbed. So it's an alternative which for some people they may find useful. Next slide. The other interesting design of this medication as a gel film is that it has low carbohydrates. In fact, it has lower carbohydrates in terms of grams of carbohydrate per dose than the tablet or the liquid that we're used to giving. And now there's many generic forms of clobazam, so some will have different amounts of filler that could be carbohydrate. And for people on a ketogenic diet, which requires no more than 10 grams of carbohydrate a day, if you can save them, a large amount, like 0.0025 grams of carbohydrate versus 0.2 grams of carbohydrate per dose, that can be a big difference. So for some people who might have a sensitive ketogenic diet, it gives you more carbohydrate calories to use elsewhere than in your medication. So that's another advantage, the way this was designed to help with the ketogenic diet for patients who are on that. And if you take a 40 milligram a day adult typical dose of clobazam, you could save up to 3 grams of carbohydrate. So if you think about it, that's almost 30% of your daily ketogenic diet allowance. So for some patients, that could be important. Next slide. If you want to find more about this medication and other information items, please feel free to visit the lgsfoundation.org and get more information there.